In August 2010, Nicholas Daniak took part in a clinical trial at the Weill Medical College of Cornell University in New York City, in an attempt to slow the progression of Batten disease. The trial would culminate with an aggressive and delicate surgery. Nicholas will be the first child in the world to undergo the operation. Nicholas experienced a slow and steady decline over the months leading up to the surgery. Prior to his evaluation in the early spring, he was able to walk with assistance and was strong. At the beginning of the summer, Nicholas needed increased support while walking. In addition, Nicholas needed the support from a wheelchair at times during the day. Having Nicholas spend any time in a wheelchair broke our hearts, but it was the safest choice for Nicholas and his caretakers. The goal of this study is to see whether gene therapy improved the outcome of children in a narrow therapeutic window. Due to the way the study was set up, Nicholas could not be too healthy or too sick. We knew that if he was not accepted for this trial, he would continue to deteriorate and his chances for a cure would be gone. It was agonizing waiting for a call, not knowing whether Nicholas would deteriorate to the point where he would not be a candidate. When we finally got the call, it was a feeling of disbelief. Chris and I were anxious over the unknown. There was a sense of hope, but still far off. Our concern that while the surgery was his only shot to live, it might take away the Nicholas we knew forever, and also shorten any days we had left with him, but it was our best hope. There was a sense of awe that Nicholas was the first in the world to receive this therapy. What would this mean not only to Nicholas, but to all the other children with Batten disease and the field of gene therapy? If the surgery was successful, this might change the way we treat many other neurodegenerative diseases. We packed for this 3-week journey. Chris, Nicholas, Shane, and I, our service dog, were out the door on Wednesday, August 18, 2010. We were met in the lobby of the New York Presbyterian Hospital, brought to admissions, and then brought to the pediatric wing. We met with one of the scientists who reviewed in detail the study and our rights, followed by an exam by a neurologist. He asked Nicholas to walk, which he did with assistance, drink from a straw, feed himself, follow commands, and then he completed the neurological examination.
Hold on, no, one more.
The results of the initial examination were reviewed by 2 other neurologists, and we wouldn't find out if Nicholas would be accepted into the study until the following morning. We found out the morning of the second day that Nicholas was accepted into the study, which was great and relieving news. The rest of the day, Nicholas underwent a 24-hour EEG, so he relaxed watching movies and reading books with Shane by his side at all times. Day 3, the EEG leads were taken off Nicholas's head and no seizures were to report.
That's it.
Hold on. It was the weekend now, but we were still not able to leave the hospital.
Got me, Grandma. Oh.
We had family come to visit for the weekend, and we did a lot of walking and playing with toys. On day 4, nothing was scheduled except to remain in the hospital.
Nicholas, is that good? You ate one of those meatballs? Holy smokes.
Where'd all that food go? See in my belly. Ooh, look at that big belly. I'm full. You're full.
Nicholas did have a small 20-second seizure. An IV was quickly started, and Nicholas ended up relaxing the rest of the day after the seizure. The study team reviewed again if we were still eligible for the study. It was agreed that Nicholas had great overall seizure control, so we still had the green light to go through with the study. We were so relieved.
What's your name?
Buzz.
Buzz. Buzz what?
Nicholas.
Buzz Nicholas?
The morning came quickly. A volunteer transported us down to the operating room.
Before we step into the actual OR, we're gonna have to put on a blue jumpsuit.
Sure.
You guys have you done this before?
Yeah.
I gave Nicholas a big hug and a kiss. Chris gowned up and carried him into the operating table. This was it, and there was no turning back. The goal of the surgery was to replace the missing gene in Nicholas's brain, which was causing him to die. To do this, 6 burr holes had to be drilled through Nicholas's skull. Through these burr holes would be placed long, thin needles, which would deliver the normal gene with the help of a rhesus monkey virus. This delicate procedure would hold the hope for Nicholas's survival. The surgery was 5 hours. The study coordinators came into the waiting room to get us, reporting that everything went extremely smooth for Nicholas. We could then go into the pediatric ICU to see him. I looked at Nicholas and burst into tears. I'm a mom, and seeing Nicholas after surgery was scary to me. The top of Nicholas's head was shaved. He had 3 1.5-inch incisions on the left and right sides of his head, with about 8 to 10 stitches in each. They were slightly bloody, but they looked clean and neat. Chris assured me that medically he looked great. His oxygen and heart rate were in excellent range. He did not appear to be in any distress or pain. That night, as Nicholas began to wake up, he had several episodes of vomiting, which required immediate attention and medications. 2 days after Nicholas's surgery, he woke up at 6 a.m. and wanted to listen to his movies. He was able to talk a little and respond to one-word sentences to questions.
Who's dopey? You're dopey? No way. What's daddy? Who's daddy?
Happy.
I'm happy?
As symptoms subsided, our old Nicholas began to wake up.
Come here.
Do I have to kiss you? Kiss him? Go. Can you blow him a kiss? Or you just blow him a kiss? Go. Nice job, Nicholas.
A tube feeding was started on this day to get his stomach churning, and medicines were given through his nasogastric tube.
Excellent.
So it's a different kid today than you saw yesterday.
Yeah. I would say so. It's really important. That's awesome.
Yeah, he's got a lot of fight.
By Friday, which was 3 days after surgery, Nicholas was looking better every hour. His IV and nasogastric tube were both turned off. Medicines were given by mouth, and the staff wanted Nicholas to eat by mouth.
Look at you! Wow, Nicholas!
Moments later, a smiley Nicholas got out of bed with assistance and walked wobbly down the hall with Chris. We were thrilled.
Good job! Good job, Nicholas!
Dr. Ali. He's walking.
The hospital staff decided there was no reason to keep us any longer, and we were discharged to the hotel.
Not too far, okay?
Okay.
Come on back in. Let's.
That's tremendous.
Wow, I'm so proud of you, Nicholas. Looking good.
All right, you want to do one jump? Jump. Nicholas, what are you doing? You going for a bath?
The day after we were discharged, I was able to give Nicholas a bath, being careful not to get his head wet, but just to wash his stinky body. It made him feel so good. We rested most of the day in the hotel and later went out for lunch.
I'm ready. Go. Whoa, good throw.
Nicholas was in good spirits, and we didn't push his physical activity at all. We had to stay in the city 12 days after being discharged. We made the most of our time. On September 8, 2010, Nicholas was discharged from the hospital, and our family returned home to New Hampshire. The clinical study is still ongoing, but initial results are positive, and hope is as high as ever that a cure for Batten disease is just around the corner. I reflect back to what we went through in New York City with Nicholas's brain surgery. I'm relieved it's over, but I'm also thankful that we were given the chance to save my son. I would do it all again if I was given the opportunity. In the months after surgery, I have not seen any significant decline in Nicholas. He continues to have difficulty with speech and mobility, but he can still communicate his needs, and he is still getting around walking with assistance. Batten disease is potentially curable if given attention and money. Research is essential to conquer this battle. Please join us in our promise to Nicholas to cure this disease.